Order, order. Andy Slaughter to move the motion.
Mr. Rossiter, it's a pleasure to see you slide effortlessly into the chair at the beginning of this debate, and I'm grateful for the opportunity to raise what is perhaps the central issue for my constituents, which is the future of the major hospital in my constituency, although I also, of course, have the world-class Hammersmith hospital there, and not only to me, but to many people across West London, which is why I'm very grateful to see my honourable friends from Brentford, Isleworth and Ealing Central and Acton present as well. Next year will be the 200th anniversary of Charing Cross Hospital and the rather more recent 45th anniversary of the current building on the current site, although I should say that there's been hospital, previously the Fulham Hospital and its predecessors on that site since 1884. So this is a long history, but also a prestigious history. This is one of London's major teaching hospitals, part of the Imperial Healthcare Trust, and one that doesn't rest on its laurels, but which has an unprecedented level of demand and indeed a growing level of demand. But I will spend only 2 minutes of my time on what one might call history, and that's simply to set the scene, because I've deliberately titled this debate The Future of Charing Cross Hospital, and I've been in contact with the Minister's Office to try and indicate how I would like to move this long-standing SOAR for the local community forward, if not entirely this afternoon, that may be asking slightly too much, and certainly over the next weeks and months. Yes, it is about history, but it's also about a rather devastating series of decisions, and these are not new decisions, because the first time that there were plans to substantially downgrade the hospital were back in the 1990s, and I remember being involved in campaigns then which were led by the former Member of Parliament for Brentford and Isleworth, which is when she later, Anne Keane, when she later became a health minister, I knew that the hospital was in safe hands. I hope it's going to be in safe hands with the honourable gentleman as well. But the current events began with great surprise, and that, it may surprise the Minister, I say, with great surprise, because the plans for the changes at Charing Cross were done largely in secret over 2 years, from 2010 to 2012, and then when they were announced in 2012, it was for a full-scale clearing of the site, all buildings of the Imperial Trust on the site, save for a new clinic to be built on 3% of the existing site. That was modified in 2013, partly, I think, because of pressure and to give some cover to the then local authority and others, which was Conservative controlled, to get behind the proposals for the changes to the site, with what was described as a new hospital, but which is in fact, and I don't think, and I do say advisedly, in fact, a collection of primary care and treatment services with an urgent care centre, which is going to be called a local A&E, and it's going to be called a local hospital. But there's however, let's not get hung up in the terminology here. It's very clear what actual services will be provided on that site if the proposals go ahead, and that it will be on 13% of the current floor area of the existing hospital. And that is what has caused problems and difficulties. And of course, I'll give way to my friend.
Thank you. And may I congratulate my honourable friend and constituency neighbour for both bringing this debate, but also for his leadership in the campaign on the future of Charing Cross. And will my honourable friend appreciate that the principal fear was about this issue is the loss of the accident and emergency service at Charing Cross, the full-scale accident emergency service. That in itself has been a great fear among my residents, particularly in the eastern half of my constituency, but also from a far wider area, because the loss of accident and emergency also potentially means the downgrading of many services, inpatient and outpatients, which are linked to the fact that there is a full-scale accident and emergency service there now.
Yes, I'm very grateful and for the clarity of my my friend brings to that point that what is proposed is the loss of all consultant emergency services, so type 1 and type 1 A&E, therefore no blue light ambulances, loss of emergency surgery, loss of, say, emergency consultant services on the site. That's a very substantial change to the health facilities available there. Now, this was branded, it was under the heading of Shaping a Healthier Future, which I'm afraid my constituents regard as a rather Orwellian title, but that programme itself has now become subsumed in the Sustainability and Transformation proposals, which are now nationwide, but essentially the meat of the proposal has not changed over that time. And I do not, Rizal, I look for points of agreement, if I can, that some of the objectives there are perfectly laudable agreements. Specialisation, bringing together expertise on a particular site, as has happened with stroke services, with major trauma, with renal services and so forth, even within the 3 hospitals in the Imperial Trust. That's to be commended. Improvements to primary, to social, to community care, which may in time lead to less pressure on acute services. Again, no one objects to that, and if there is a consequent, not just better health outcomes, but saving of public finance, again, that's the case. The problem is, and the reason why there has been a breakdown of trust, is that the changes are being advanced before those consequences can be seen. So, of course I'll give way. Yeah.
I'm grateful to my honourable friend for giving way. Would you not agree with me that these plans may be transformational, but they are certainly not sustainable, given that London's heading for a population of 10 million before long? Even his own borough, Hammersmith and Fulham, there's projected to be 12,000 more people between that last census and the 2021 one, the next one. We were both at a meeting on Monday night when he pointed out that the borough has a target of 20,000 new homes by 2035. Where are all these people meant to get treatment when we've lost A&E at Charing Cross, at Hammersmith, we've lost maternity and paediatrics at Ealing? Demographically, this is illiterate.
Well, my old friend puts it very forensically, because the difficulty is, however much the aspiration may be to relieve acute services, most independent analysis, and whether this comes from the King's Fund or whether it came from the Mansfield Review, specifically local to West London, is that is not likely to happen in the foreseeable future. And indeed, any additional investment, and there's precious little, into primary or social care, is barely keeping up with the pressure on those services. And that, as I say, is where the lack of confidence comes from, because however pious and laudable the aspirations are, they are simply not happening in fact. So I welcome the announcement that nothing is going to happen in the current STP period, which runs to 2020, which is an admission by the government that pressures on services are so great that one couldn't possibly think about the downgradings that have been proposed at the moment. But that is simply putting off a wrong decision, in my view. And although that means that nothing can happen physically to the Charing Cross site other than to maintain it until 2021, and I've been told privately that probably means a number of years beyond that, given that the eastern part of northwest London, which includes the 3 Imperial hospitals, has now been put in the slow lane behind what's happening in the western half. I've been told it's unlikely that any changes will happen before 2025. That's 13 years after the first proposals were put forward. I mean, that's a very long time in politics, but it's a very long time in the NHS as well. And so what I'm looking for the government is something more of substance, because we've had virtually nothing in terms of writing, in terms of consultation, in terms of engagement with the public since those announcements back in 2013. What has grown up in the vacuum that's been created by the health service simply not engaging is a substantial expertise in the community through say their hospitals movement, through the trade unions, and indeed through local people generally. An independent survey, conducted independently by a polling organisation, recently showed that 90% of people in the West London area oppose these proposals. 90%. And that's borne out in every other possible survey that I've seen, and that 82% think they haven't been involved in the decisions properly. And I urge the Minister to listen to those and to turn over a page in terms of engaging with the community in relation to those matters. I go back to the point which my old friend for Ealing Central Action raised. Last month, the 4-hour waiting time was only achieved in 70% of cases for the two hospitals in Imperial. They're not disaggregated, so I can't give you exact figures for Charing Cross, I'm afraid. But St Mary's and Charing Cross combined, 70% seem within. And that has been a regular pattern over months and years previously, and in particular since the closure of the A&E departments at Central Middlesex and Hammersmith Hospital. The population is growing hugely. The health demands, not just because of an ageing population, but because of a very mobile and a very diverse population in the area, have been growing. And these are not, on the whole, people who do not need acute care. Indeed, it's been the case, it's been good practice at Charing Cross for many years that if you arrive at that hospital and you have something that can be dealt with by a nurse or a GP or in some way, or an urgent care centre, some way other than needing consultant care, you are simply filtered off because all those services are available on site. This isn't the case of unsuitable use. This is a case of growing demand and a lack of resources to deal with that demand. And that's why I do urge the Minister, and I'm going to sit down in a moment because I want to give the Minister a proper opportunity to respond, to not read out the brief again, because I've heard it with respect a number of times over the last 5 years. I genuinely wish to engage in trying to reassess what's happened. So I welcomed in the debate in the other place on the 18th of October, which was called by my friend Lord Dubbs, who's a Hammersmith resident, and who, well, more eloquently than I could, led a debate which a number of peers took place in, specifically again on the issue of Charing Cross. And the Minister there responded by saying, there will be no reduction in A&E or acute capacity at Charing Cross Hospital unless and until a reduction in acute demand can be achieved. Now, those are very welcome words to have put on the record, and I'm sure the Minister will not be resigning from that today. But what I would ask is that there is therefore an assessment of whether that is likely to happen, whether that is likely to happen in the foreseeable future. Because if it's not going to happen for another 4 years or 8 years or 12 years or however long, I've simply put it to the Minister that they cannot persist with simply saying, we will do this when the time is right. It creates uncertainty, it creates demoralisation among staff, it gives a motivation for management not to maintain and keep services up because they're effectively throwing good money into a building they believe will not be there within the foreseeable future. So that's my first request to the Minister, that we do have a proper assessment of whether actually that Shaping a Healthier Future proposals are still fit for purpose, as the government believed, even though I didn't, in 2012. And the second point, which the Minister made, is that none of the land on the hospital site has been designated as surplus land for redevelopment. Now, I would push the Minister to say what exactly is meant by that. We were told in terms, in 2012 and 2013, that that land that would not be used for health service purposes would be disposed of privately in order to subsidise the cost of the building on the land that would remain within the health service. So is that supposed to mean that that is now not going to happen, or is it simply that no formal proposals have been brought forward? This, as I've said, has been a hospital site for well over a century. It's a hospital that's existed for 2 centuries, and it would be a great pity if on my watch and the Minister's that no longer became to be the case, particularly at a time when it is most needed by those in my constituency and others who have used it throughout their and their families' lives.
The question is that this House has considered the future of Charing Cross Hospital. Philip Dunn.
Thank you very much, Mr. Rossendale, and it's a pleasure to serve under your chairmanship this afternoon, and a pleasure to have been left sufficient time, hopefully, to be able to address some of the concerns raised by the Honourable Member for Hammersmith and Fulham, who I'm grateful for engaging with my office in advance to indicate the line of questioning he was going to take in this debate, and I think he's made his points with characteristic skill and calm composure, which is much appreciated. I'm going to set the issue of Charing Cross within the context of the wider STP for North West London, which he referred to briefly in his remarks, because that is how the NHS is now looking at the future of healthcare provision for populations across the country. And Charing Cross, within the Imperial Trust, sits firmly within the North West London Sustainability and Transformation Partnership, the footprint for which has funding of some £3.7 billion and at present, and between 2015 and 16 and 2020-21, this is expected to rise by over £600 million, an increase of some 17%. And I would say to him, as he is aware is government's position, that any potential service change affecting Charing Cross is a matter for the local NHS. It will be determined primarily through the prism of the STP and the leadership for that wider NHS group. And in our view, it is right that decisions for service configuration are led by local clinicians who understand better than the national NHS the healthcare needs of their local population, and that they do so in consultation with local people, which is one of his challenges to the process. All proposed service changes will be based on clear evidence that they deliver better outcomes for patients. Indeed.
I wonder if he was familiar with the King's Fund analysis of the STPs from February of this year, 2017, which concluded that despite all the warm words about the new models of care, they're actually driven by financial imperatives more than clinician-driven.
No, I don't agree with that. And of course, the analysis that was done at that time was into the preliminary drafts of the STPs before they'd had any assessment by NHS England or indeed by the Department of Health. So these are evolving plans and becoming partnerships, and they will move at differing speeds in different parts of the country, depending on the quality of the work that has been done and the extent to which they meet the 4 tests for service change, which I was going on to, which are that they should have support from GP commissioners, they should be based on clinical evidence, they should demonstrate public and patient engagement, and they should consider patient choice. In addition to those, NHS England introduced a new test from the 1st of April this year on the future use of beds, which I think is pertinent to the Charing Cross case, which requires commissioners to assure NHS England that any proposed reduction in acute hospital beds is sustainable over the longer term, and that key risks such as staffing levels have been addressed. The plan for North West London, the STP, was published in November 2016, and it confirmed at the time that the Shaping a Healthier Future programme, which the Honourable Gentleman quite rightly referred to, published in 2012, had set out the right plans to reshape health services across North West London to respond to rapidly changing health and care needs. So the Shaping a Healthier Future plan does form a core part within the STP plan. It is my understanding that STP leadership intend to take that forward. There was a full public consultation in 2012 on these plans for a more integrated approach to care, whereby specialist services would be consolidated on fewer sites across North West London to improve quality and efficiency, and routine and chronic care would be expanded to improve access, particularly in the community. It was proposed that Charing Cross would become a growing hub for integrated care within this network of services. and following feedback from the public consultation, the proposals were refined to retain a wider range of services than was initially proposed on the Charing Cross site. In October the following year, in 2013, the Secretary of State for Health clearly set out, following the full public consultation, that both Charing Cross and Ealing hospitals would retain A&E services, even if in a different shape and size from current arrangements, and this remains the proposal today. But no final decisions have been made about the exact nature of services that are planned to continue at Charing Cross Hospital. What is certain is that even if changes are made, there will still be a thriving Charing Cross Hospital. There will be an engagement with the public in due course on the detailed design and implementation of services on the site, which will include cancer, outpatients, diagnostics and 24/7 local A&E services. The STP is initially, I'll just finish this point if I may. The STP is initially focusing, as the Honourable Gentleman quite rightly said in his remarks, on developing new models of care to reduce demand on acute services. And I'm grateful to him for welcoming the improvement of services in the community so that it can then be established that those are working before acute reconfiguration takes place through this proposal. I give way to the Minister.
I'm grateful to the Minister again for giving way. He's been very generous. He pointed out that no final decisions have been taken, but can he not appreciate that that uncertainty creates a lack of morale for the staff there? I had to visit Charing Cross very regularly for my late mother, who we lost during the election campaign. Her specialist, Dr. Perry, was there, and there just seems to be a sapping of morale from the staff there. It's demoralising because they don't know what's going on.
Well, I'm very sorry to hear about the Honourable Lady's mother. She has my considerable sympathy and condolences. I'm going to come on to the issue of staff morale, and I think she's quite right to raise it. And it is important that we, whichever side we're on in this debate, do what we can to ensure that the staff of all our NHS facilities, particularly in this case Charing Cross Hospital, have confidence and clarity that they have a good career prospects working in that hospital. And however we describe the challenges in our local NHS, we shouldn't try to undermine the importance of those facilities to our local residents, and therefore the importance of encouraging staff to continue to work there.
I'm most grateful to the Minister for being very generous. What I said, I think, is that I applaud the aims of improving community services. My CCG is facing £17 million of further saving. That puts great difficulty in maintaining services, let alone improving them. And Imperial Trust has a huge deficit. And as far as I can see, most of the Sustainability and Transformation funds for the current year, or the year just gone, have gone into addressing those deficits. That's the difficulty with putting this forward. That's why I asked for a review of where we're going, because these are hopes which aren't being fulfilled.
Well, I think it is fair to say that part of the objective of the STP is to help the NHS within a particular area work more cooperatively together to encourage better sort of public health for the population as a whole, and thereby work within the available budgets that have been allocated to them by NHS England, and creating a coherent plan for the entire area, we think is the most logical way to try and ensure that happens. As I have stated, Mr. Rossendale, service change is a matter for the local NHS, and the local NHS have been clear that there will be no changes at Charing Cross before 2021, as was acknowledged by the Honourable Gentleman. In the meantime, as the Honourable Member did not reference, NHS England have confirmed their commitment to Charing Cross Hospital and invested £8 million in the hospital in the last year alone. This funding enabled refurbishment of urgent and emergency care wards, theatres, outpatient clinic and lifts, as well as the creation of a patient service centre and the main new facility for North West London pathology. Further significant investments are also planned, notwithstanding what the Honourable Gentleman says about the current financial situation of the Imperial Trust. It remains the case that the STP is planning in due course a phased new build across northwest London, including on the Charing Cross site, rather than refurbishing existing buildings. But the STP is not yet at the point of finalising that plan. And I can confirm, as he asked me to do, that no hospital run by Imperial College Healthcare NHS Trust, including Charing Cross, has declared any site surplus land. He asked what commitment that means for the future. And clearly, until the plans are completely finalised, it would be wrong of me to give any further indication on what that might mean in relation to land, because it will depend on the configuration of the buildings that have yet to be designed. So it would be an unrealistic expectation to be definitive about that today. To go back to the point made by the Honourable Member for Ealing Central Acton about workforce, as I say, I'm glad she's raised it. It is unsurprising that discussions about proposed service change has created some uncertainty for staff, patients and other stakeholders, including local residents. But there has been a very clear position on the future development of Charing Cross since the STP plan for North West London was published a year ago. And this position has been shared widely with staff and all stakeholders. And as I said earlier, I sincerely hope that, that my remarks today can help to reassure staff working within the hospital that there will be no changes to service levels until at the very earliest 2021, and that the local NHS's commitment to Charing Cross Hospital has been reaffirmed. In August of this year, the Trust leadership undertook a review to understand more fully the issue of staff morale at Charing Cross and to develop any actions in response to that review. The conclusion was that site-level data does not indicate that Charing Cross is affected by poor morale or has more difficulty than any other sites within the Trust in recruiting and retraining staff. There are, however, higher vacancy levels among a few specific staff groups in certain areas, such as elderly care. So in response to that review, the Trust leadership team have established an action plan, including organising a succession of staff briefings, and the Trust earlier this week announced a public meeting for local residents on the 27th of November, to ensure clarity on the future position of Charing Cross, and as well as sharing information about recent and planned investments on the site. And I would strongly encourage the Honourable Gentleman to attend that meeting if he's able to help provide his, to understand what the Trust are saying and to provide reassurance to local residents of the state of the hospital. The Trust has been in correspondence with the leader of Hammersmith and Fulham Council regarding mailings that they have been sending to residents which do not reflect the evolving position at Charing Cross, as well as raising constituents' concerns. We have a responsibility to allay fears when discussing this, as I've said earlier, and we can best do that by being clear about what is and what is not in prospect, and by encouraging them to take up the offers of engagement made by local decision makers, which I understand the Council has expressed some concern about doing. The Government remains committed to supporting the local NHS to engage well with its local population and local clinicians to ensure that decisions about services in North West London are made in the best interests of patients now and in the future. And I hope that the Honourable Member's constituents who are paying attention to this debate will make the most of the opportunities to participate in future public engagement on the design of services in their area, and as many as possible will attend the meeting on the 27th of November at the hospital. Thank you, Mr. President.
The question is that this House has considered the future of Charing Cross Hospital. As many as other opinions say aye. To the contrary, no. Order, order.